Right. Good afternoon, everyone. Yeah, thanks for joining today, and thanks for taking the time out of the day to join our webinar. Just a couple of kind of house rules and how we're going to proceed today. So, quick introduction from myself on C-STEM, handing over to Rich Groom to cover the slides from Armis. So he'll do a quick introduction when he lands with his deck. Session is being recorded today. So we will follow up with you. So if you do drop off for any reason, or you're required to share it with your wider team, the recording will be going out tomorrow. As we've got a short session, if there's an opportunity you would like to ask a question, someone will be monitoring the chat. So please do drop any questions into the chat and we'll get them answered at the end. We have also got Nick Morgan, who is from Armis, and he's a solutions engineer. So if there is something technical that pops up into the chat, we can hand over to Nick to answer any questions. So I'm just going to quickly share my screen. Right, so we might have engaged with you guys previously. You might have seen this deck. You might have had a little conversation with us at the Excellence in Healthcare event earlier this month. But this is just going to be a quick intro on C-STEM, who we are, and where we sit in the market. So we're a company based down in Newport, primarily focused on public sector and working a lot with the NHS Trusts in partnership with Armis. Our main objectives when we join organizations is helping them improve their DCR effectiveness within the organization. As we know with the NHS, many organizations are detecting, complying, and responding. Our aims when we do engage with you is to increase that across all three areas. As we engage with hospitals and NHS trusts, everyone's digitally transforming. The equipment is becoming more advanced. It's becoming more challenging to see on the network, control, and put these parameters in place to enable your teams to support, efficiency across the teams. So C-STEM works with you on this digital transformation journey that you're on, understanding where you're on in this landscape, and then providing you with smart services, which one of Armis is one of them in our portfolio, to help you tackle and achieve these goals that you've set out for yourselves. By adopting a smart service with C-STEM and Armis, ultimately what that will do for you guys as an organization, it will improve that efficiency and productivity within the organization. It will also then drive down time, effort, and costs, which is a massive selling point for the NHS when they are looking and embarking on new projects. You ultimately need to demonstrate that ROI and saving of money. So ultimately where we sit to C-STEM, as we've said, NHS trusts have invested in this technology. All we're looking to do is understand actually where you are in this DCR effectiveness journey, and ultimately plugging in a service that will take you from your current state to your target state. So once we go through a qualification procedure with you, what we'll do then is ultimately map it against where Armis fits for you and build out that journey of the 6, 12, 18 months to get you guys from actual to target effectiveness. And this is my last slide. This is just a case of us saying these milestones have been set by you and your team. By working with C-STEM, onboarding us in partnership with Armis, ultimately what that will do for you as an organization, it will accelerate those milestones for you. So we're not coming to conflict or change those milestones in the journey you're on. We ultimately want to come from a direction of understanding and then implementing to support and accelerate those milestones, which will then give the team that time back, ultimately save you guys money, but also put you in a data-informed position to make better decisions moving forward as an organization. So that's a bit about C-STEM. If you want to get in touch with us to have a chat after you've seen what Rich is presenting, please do reach out to myself and the team, and we're happy to book in further demos and conversations.
Thanks, Ty, for your overview there. So hopefully you can now all see my screen.
Yep.
So yeah, really wanted to, as Ty said, really thank you for your time this afternoon. Now everybody's very busy at this time of year, DSPT, etc., all going on. Really wanted to do is just give you a really kind of quick, high-level overview. Hopefully, some of you will have met the recent event, and others are look forward to meeting in the future. So really wanted to just touch on is how unlocking asset intelligence drives operational excellence for the NHS. And we do this across multiple customers and globally around the world. So we'll touch on that as we go forward. So quick agenda, obviously a little introduction to myself. I've been working in the healthcare team here at Armis for the last 3.5 years. During that period of time, we've engaged with probably 40 or 50 trusts, around 15 to 20 are now customers, which is great. We've learned a lot during that time, and my team with Nick and others. We've learned a lot about how to deploy a solution, the value of our solution to the NHS, and also the kind of how this leads to operational efficiency rather than just looking at one particular thing, which a lot of the time starts with DSPT, and we can look at that. In terms of, we'll also look at some freedom of information. We regularly do these exercises, and really it's just to validate, do some research into the market to understand where it is. So I'll touch on that as well, and then how our solution can drive that positive change in line with what happens with C-STEM. In terms of next steps, what we'd really love you to do is, if this sort of whets your appetite and you kind of think, oh, I'd like to learn a little bit more about that, whether it's about where we fit into the market, a bit about Armis, how this is going to work in your environment, then please get in touch with C-STEM, and they can book a demo or a POV so that you can see this working in your environment. I thought it was important to sort of state, kind of, and obviously you work in this sector, but kind of how complicated a modern healthcare delivery organization is, and really all the things that you have to contend with, and really this aligns with our solution. So there are solutions in the markets that'll just look at IT devices or medical devices, but from the Armis perspective, we're looking at you holistically and saying, look, you do provide services across all of these different areas. So a modern healthcare delivery organization is a multitude of different things, and it's a multitude of different services, some of which are in your control and some of which aren't. You also have the most complicated environments we work with. So Armis works across enterprise organizations, manufacturing, pharmaceutical and healthcare organizations, and medical environments are the most complicated because you do have every type of device in your environment. So being able to understand every device and the behavior of every device is critical to the operational efficiency of your environment. So connected care requires connected technologies. So we just quickly flip through these, but in terms of, you have all of these different types of assets, and you perhaps have more within your environment. There's obviously a shift towards remote wards, but the proliferation of medical devices in particular, and the proliferation of devices that now no longer look like medical devices, they will look like iPads, they will look like IT type devices, but they're providing medical services, is meaning that the connected care that you're looking to provide requires ever more connected technologies, and the connectivity between those devices becomes ever more important. And obviously, if all of those things work as they should, then this is absolutely fine. What we're able to provide you is an overview of every device that you have. So looking at that first piece as an asset inventory of every device you have, then looking at the interdependencies between those devices, looking at the risks, and then being able to take appropriate actions to build a connected health system. So all of these devices are communicating. I'm sure that's not news to anybody here, but also there are the devices that lots of times we see that organizations don't really appreciate that they are connecting. So there are things like TVs in environments that are communicating, they're looking to provide updates. So an LG TV, we're looking to go to LG, or Samsung to Samsung. But it's really what happens if that starts doing something else. What happens if the building management system becomes compromised? What happens if a patient connected device starts connecting to an external Wi-Fi and then through to Facebook? And we've seen those things with an MRI scanner being used as effectively as a PC, as a computer connected to Starbucks Wi-Fi, and then that out into the world. which obviously is a a potential threat to the business and potential threat to patient information. In terms of what we definitely see is these are a lot of connected devices, and in the medical environments in the NHS that we see, you have lots of different people. So we're often brought in by a network team or a security team, an IT team, and often the start of that journey is them looking at it and saying, look, I need to provide a DSPT report. I need to look at the cyber alerts. I need to understand what's going on in my environment. A lot of the time, the facilities management people are not involved in those conversations, and the biomedical EBME teams are also not involved in those environments. So what we see is that there are different priorities, different teams who are often using different tools. What we provide is the ability to bring all those things together so that you can have a centralized tool that delivers value for every part of the organization. Our most successful deployments are very much on that basis, where it may be the IT department, maybe the security department who own the tool and look at the implementation of the tool. But when the facilities management can start to understand the building management systems that are involved in the hospital, and they can see value from that data, the biomedical teams can start to understand asset utilization. They can start to understand when a device is being used and not being used. Can they monitor patient flows through the department, and can they then reprioritize patients to say a scanner that is not being utilized fully. So all of those things become very important as we go forward. So hopefully it's given you a bit of a background of the kind of challenges that we're addressing for many organizations. But in terms of the freedom of information, just wanted to highlight a few things, and I'd love to get your feedback in the chat of whether these resonate for your organizations. So 38% admitted that they don't have sufficient staff, and this is sufficient staff to cover a lot of their day jobs, but also to look at asset management, asset utilization, and risk of those devices. 23% said they don't have the resources to replace the legacy devices. It's really interesting that often it's a case of it's not possible to replace legacy devices as well. So it's not a case of just having the resources and the budget to replace those, but it's also, can you actually replace those legacy devices that are maybe running an old operating system? Or actually, is there a better way, and to put some controls around those devices to protect them from connecting to devices that perhaps they shouldn't? 82% of trusts said they can respond to DSPT requests, and this also applies to the cyber alerts. But the number one challenge is compiling the data and the time and effort that it takes to compile the data, and often this is still a very much a manual exercise. And then we come to the other issue, which is once a problem has been identified, may well have been addressed, and people understand what the challenge is, but then most struggle to remediate those issues within 2 weeks. And we've seen in lots of occasions across healthcare and manufacturing across the world, it can take many weeks or months to remediate issues and make the changes that are required. Okay, so if we look at some of those challenges, and I'm sure you have those in your organizations, then it becomes, okay, so why can Armis address and why can Armis help with operational resilience? So we are the leading asset visibility and security company. We're trusted by over 15 trusts in the UK, multiple Irish health providers, and hundreds of global healthcare delivery organizations worldwide, including the Department of Defense healthcare system in the US, and multiple hospital groups around Europe. So the first part of what we do is complete visibility. As I touched on earlier, we see every asset, and this is really important. So this is addressing the challenge of what do I have on my network right now? So in real time, in a passive manner, so non-disruptive to the network, non-disruptive to the medical devices or any other device, we can provide a complete visibility of every asset that's connected to the network. We can provide that contextual intelligence around what are those devices doing. So this addresses the problem of, if the first part is what do I have, the second part being why do I care? And that's really about, are these devices behaving in the way that they should be behaving? Are there risks and issues with those devices? We're able to provide that contextual intelligence because we have a cloud-based database. We call it a knowledge base, typically, which has over 3 billion devices under management at any particular time. And this is growing all the time with the number of connected devices there are in the world. We think we've got about 17 to 20% of all the devices in the world in this knowledge base. And that's really important because we can very quickly understand not only what the device is, but what it's doing, what it should be doing, and particularly, if there are there devices that are behaving in an abnormal way. We can prioritize the risks and threats to protect your business. And this is really important. Within the product, we have the cyber alerts built into the products. We have DSPT built into the product. So it just means that if you're looking for a particular cyber alert, or you're aware of a CVE and a vulnerability, then straight away you can find that device, and then you can prioritize those devices based on critical devices for your environment. We see this, and I'll come to this in one of the final slides. We see lots of organizations that get overwhelmed by the number of vulnerabilities that they have, and they don't really know where to start. So we can provide that prioritization. What are the critical devices? For example, a retail device on a guest network, or somebody visiting a patient on a guest network with a vulnerability. Well, that probably is, it's a distraction compared to if there's a critical vulnerability, say, on a device connected to a patient. And then quick time to value. So this is all around, how do you deliver a solution very quickly to maximize not only your security, but the return on the investment you're making, and particularly in a time when budgets are tight. And it's not just the budget for the tool, but it's the time and resources that are required to get a solution deployed. We are very quick to deploy. It can take 2 to 3 weeks to get the solution fully up to speed. We're happy to show you how we do this as we run through and look and do a demo and a POV with you at a later date. So I just wanted to give you a very sneak preview of what does this look like within the tool. So really looking at here, and this is what we do on a demo for you, but this is categorizing every device on. So this is just a typical device, an orthoscan in this environment. So be able to see, what the device type is, what the category it is within medical, whether it's what the underlying operating system is, where we find the device, what the IP address is, what the MAC address is. But really, it's to look at this, the activities. So think of this as a logbook. So this is a logbook of everything that this device is doing over the period of time that we see it. We can see that this is classified as a high-risk device, and it's got 4 alerts. So we can start to look at this holistically. So you can look at it in a device-by-device perspective, but every device is going to have this level of information. And then you can start to look at, where's this device? What are the vulnerabilities, risk factors, utilization? Obviously, being able to search for any device based on any criteria that device has. So then looking at, particularly in a medical environment, is to look at the device utilization. And this becomes really, really important and really of interest to medical teams. So utilization over time, as you can see on this chart, and we have many other charts that provide even more detail. But as you can see here, this device is heavily used in this 5 a.m. period, 8 o'clock, 9 o'clock. You can see where the different days of the week when this device is being used. You can see when it's not being used, and obviously that's pretty handy if you need to patch or you need to remediate, take an action on that device. The interesting part here is what we see is organizations is very quickly to then spot that, if the X-ray department is only open from typically from say 8 in the morning till 6 at night, if it's starting to be used at say 3 o'clock in the morning, it's a real flag to be able to look and say, well, why is that? why are these devices being used at a different time? We can look at the utilization of a device compared to other devices in the environment. And as you can see at the bottom, we can start to pick up from the DICOM traffic, which body part is being examined. So in this foot, it's right foot, left foot, and that's potentially okay. But for more complex requirements, where maybe it takes 10 or 20 minutes to set up the machine for the next patient, if you were doing all feet in the morning and all heads and shoulders in the afternoon, then that's probably a good use of time. But if you have to reconfigure the machine between every patient, then perhaps it's not an efficient use of time. So we can start to help balance workload across the organization. And really it's about, these machines are expensive, they're expensive to run. But also there's other pieces we pick up on utilization. So we've been asked questions where NHS trusts are looking to buy new equipment. So we were asked recently by one trust, and they said, look, can you help us with the utilization of their VoIP handsets? So they're looking to replace their VoIP handsets. They've got many thousand VoIP handsets, but they didn't have a sort of quick and easy way, or this department was working with, didn't have a quick and easy way to understand which devices are being utilized. So we're able to provide that for any type of device. We can look at the network traffic from any device and quickly tell you, are these devices being used, potentially who they're being used by, and what they're being used for. So it becomes a quick way to look at, what are the devices you have in the environment? Are they being utilized? And if they're not being utilized, can they be turned off or repurposed? We've also seen people say they've bought many thousands of devices, but they don't know where they are. We can address challenges like there are devices that, particularly during COVID, that were rushed into the environments, and not just obviously in healthcare environments. And they may not have the appropriate level of endpoint agents or security on them. So we can quickly pick those up, identify where they are. And one of the other things we get asked is, what happened to devices? So, where was a device last seen? So we see it as, a classic one is, a device was last seen in an ambulance bay. So it's been able to sort of, look at that from an investigative perspective and go, look, where was that? But we also see devices that may well have been kept by say a nurse or a particular clinic, and they've taken them off the network, they've disconnected them, they've put them in the cupboard for when they want them another day. But actually, it's really important to look from the holistic hospital environment. So when the CFO gets asked, can I, we get a request for buying more equipment, you can actually ask those questions. Well, what happened to the other equipment that they had? So being able to look at that all the way through. And then the last part here is to look at these vulnerabilities. So where in this environment, there were a number of high total vulnerabilities on a number of assets, but actually it's to drill it down into, how many of the most vulnerable assets do you have, vulnerable CVEs on particular assets. So in this example, it's been able to very quickly drill down, and particularly if you don't have a large security team or SecOps team, is to drill it down so you can say, look, just go and look at these critical devices. And in some instances, it may be that there's one affected device, go and take some action and remediate that device. So what we'd ask, hopefully I haven't been keeping a track of the Q&A. I think Nick maybe has, but what we'd ask is if this is looks of interest, we'd love to demonstrate this to you in more detail, show you the particular NHS specific reporting and dashboards we provide, and then I think a great way to look at it is we're happy to deploy into your environment, show you how quick and easy that is, and show your data within the tool so you can see it in operation, and evaluate with yourself and other teams of the effectiveness for you.
That's great. Thanks, Rich. We've got a couple of questions. I think I can see Nick busy typing to one. Nick, if you want to come off mute, you can. Okay, I've seen you just answered the one in which teams can benefit from Armis, but I think we've just had another question come in from Anna. I don't know if you can see that one.
Okay, yeah. I did type in the answer for the teams. It's very much I think we tend to focus our conversations with security networks and IT, and then clinical engineering or EPME teams will then start to get on board to understand the real value that Armis can provide, because we're often discovering assets that maybe people purchased and it was recorded somewhere, but maybe if they're finding it hard to locate them, so that can be a use case for Armis as well. To Anna's question about can GS1 barcodes be scanned, Tyron's about to answer it, but so we don't have any native barcode scanning capability in Armis, but what we can do, customers of ours can upload lists of assets into the Armis platform. You can add details, custom properties to existing discovered assets, or even create assets within Armis, but you'd need your own barcode scanning tooling. And in terms of uploading and creating those assets in Armis, you could do that through manual CSV upload or through scripting using our API. It's a few options there.
Yeah, and I think it's important to kind of mention is, so what we are really focused in is those devices that are on the network, connected assets. We can pull data from multiple other tools, so we can pull. We integrate with lots of other tools like Active Directory, your SOC and SIM tools for export, for CMBD, can't even speak, CMDB tools that you may have. But for Nick's point there, we do get asked that question of can we pull in sort of static information? We can, and we can enhance that, but it's not something we automatically discover.
Great. Is there any more questions from anyone? Appreciate everyone participating, appreciate the questions coming in. Hopefully that's kind of given you guys an overview of us and Armis and how we can support you guys moving forwards. The team will be in contact after the webinar, and what we'll do is we'll send out the recording for you to share with your wider teams. If you want to book in a demo, reach out to the rep from our side that got in contact with you to join the webinar today. We can book in a further discovery with you and the wider team to do a full demo where Nick can jump into the platform with you guys, kind of show you real world scenarios and use cases. And then if we need to, we can look at doing POVs with you moving forward. So yeah, hopefully that's covered everything for you guys today. We appreciate you guys giving us the time, and we look forward to speaking to everyone soon.